Hello, my dear students. Welcome to the third module of radiographs. In previous session, you learnt about the simple radiographs of limb under the heading what are plane and contrast radiographs, how to determine the side of the limb, region of interest if it is joint involved, how the region of interest is focused in the center of the field, and how wave is determined, AP wave, lateral wave, oblique wave, and also how soft tissues, bones, and joints shadows are seen. One last point is underlined here, that the epiphyseal lines and epiphysis. This is not covered in previous session. In this session, initially we will cover this epiphysis and epiphyseal lines of simple radiographs of limb. Then we shall move on with this module. So epiphysis and epiphyseal lines. Epiphysis are the distal ends of long bones, which are separate centers or secondary centers of ossification, which gradually fuse with diaphysis, metaphyseal end of diaphysis, as the age advances. In this radiograph, we can see the age is 13 years, where lower ends of radius and ulna epiphyses are separately seen, which are not fused, which usually fuse at around 14 to 17 years of age. Because of less age, this has not been fused here and here. You can see these are epiphyses. In some x-rays and examinations, if you find, you should not get confused with carpal bones. So when they fuse, so this is again one more radiograph of different person, where you can see appreciate a delicate line. This is line of fusion of epiphysis. So definitely this is more than 16 years of age. So age can also be determined by looking at the appearance of epiphyseal ends and fusion of epiphyseal ends, which are different for different bones in limbs, so which serve important medico-legal aspect. In module 3, the objectives are to read the simple radiographs of head, neck, chest, and lumbosacral area. In head, we look at AP weave and lateral weave of skull, neck AP and lateral weave of cervical vertebra, and chest PA weave of chest with lung fields and cardiac areas, and also lumbosacral area with KUB, that is kidney, ureter, and bladder field radiographs. This is simple radiograph of head, AP weave of skull, where you can appreciate the cranium as well as mandible. You can see here the orbital margins. These are the orbits. Midline, you can see the nasal septum, vomer, nasal septum, and these two are the nasal cavities. Just medial to the orbit on either sides, you can see here these two black shadows are of ethmoid sinus. Let us collect all the sinuses at once. These two are ethmoidal sinuses, and you can see here this black shadow and this black shadow. These are of frontal air sinuses, and this is maxillary air sinus on either side. Sphenoidal cannot be seen in this AP view. Orbit. This is cheekbone, zygoma. This is maxillary bone. Upper sockets and upper alveoli and teeth can be seen, and this is lower jaw, teeth, angle of the mandible, symphysis menti, and you can also appreciate few cervical vertebrae in AP view. In some of the x-rays, you will see outer and inner tables as well, separately. As you can appreciate here, there are two lines for the vault. They are because of intervening diploe between outer and inner tables, which can be often appreciated. Again here, frontal sinus on right side, and this is orbital margin, ethmoidal air sinus, nasal cavity, maxillary sinuses, upper jaw, lower jaw with alveoli, and this is infratemporal region. You can see R here. This is because we have to determine which side this is. For example, if there is any bony pathology here on the right side, this mark serves that this is of right side. You can flip the X-ray or radiograph to see uh, from other side, but definitely this side belongs to right. So we have to determine the side when the X-ray is of even central, and even chest X-rays we have to determine the side. And this is lateral view. This means this is right lateral view. Rays have passed from right side to the left, right lateral view. And you can appreciate here again outer table and inner table intervening diploe very clearly here and here. And this is the superciliary arch. You can see this is maxillary sinus. Of both sides get overlapped here. You can see multiple shadows because of two different cavities. One is this one, other one is this one. So these are both sided maxillary air sinuses overlapped. And this is hard palate, maxilla, and alveoli. This is the mandible. You can see this is one sided angle and this is other sided angle because this is overlapping. And this is TMJ. You can see coronoid process here, symphysis menti. And in the middle cranial fossa, you can appreciate sella turcica. This is the concave marking. You can see this is sella turcica, and just below that, this is body of the sphenoid and sphenoid air sinus. This black shadow is because of sphenoid air sinus. And here you can also appreciate some black shadows because of external acoustic meatus. They may be two. They may be overlapping from one to other side. And these are few cervical vertebrae, and you can also appreciate a bone here. This is hyoid bone below the mandible. You can see soft tissue shadows. This is one more special type of X-ray. I mean, the simple X-ray itself, a special variety in that is lux view, where rays will pass through mouth and go on the through the upper part of occiput. You can appreciate more clearly here the frontal air sinuses. These are the margins of orbit, and this is the oral cavity. This is the shadow for the tongue, and this is the maxilla, and this is the lower jaw with the teeth, and these are the maxillary air sinuses. You can beautifully appreciate inner and outer table and diploe continuation without any break. This is about radiographs of head. This is simple radiograph of cervical region, neck, lateral view. You can see here this is right lateral view. You can count the cervical vertebrae 1 to 7 from here, or from here you can go looking at the longest spine. This is C7, body of C7, C6, 5, 4, 3, 2 and 1. This is atlas. This is axis. So this should be odontoid process or axis for second vertebra. And there are no spines for first and second vertebra. You can see gradually the spine is elongating, and this is the longest spine for C7. You can see here external acoustic meatus here, inner and outer table. This is an extended position. I mean the neck is in extension. We shall look at one more where it is in flexed position, and this is L means it is left lateral view for the cervical vertebra. Again, let us count the vertebrae and look at the longest spine. This is E7, 6, 5, 4, 3, 2, and 1. So we may ask you in exam, identify C1. This is C1. Odontoid process. This is odontoid process. This is C2. You can see the space between the vertebrae. They are representing intervertebral discs. And here you can clearly appreciate external acoustic meatus of either sides, 1 and 2. And you can also appreciate air cells in mastoid bone here. And here as well, there are some pockets, cotton-like appearance. They are mastoid air cells. Here, hyoid bone can also be appreciated. You can see a black shadow here running down from here. This is pharynx and this is larynx. Air is present in the larynx, so it shows black shadow. In this slide, I have projected two different uh, radiographs of chest of two different patients. So let us look at this. This is right side. You can see lung fields and soft tissue shadows and also bony markings. This is simple radiograph of chest PA weave. In chest it is always postero-anterior weave. And this is cardiac shadow. This is liver shadow, and these are abdominal organs. On the right side, it is much more higher because dome is higher. Cupola of the diaphragm is much higher on the right side, and left side, this is the dome of the diaphragm. Below the dome of the diaphragm, you can appreciate here the gas shadow. This is fundic gas. Here also you can see this is fundic gas, black shadow. Below the dome of the diaphragm, there is some gas in the abdomen. This is gas in the fundus of stomach. Cardiac shadow you can appreciate. See how different cardiac shadows are on both of these x-rays, and you can also observe some shadows here, the soft tissue shadows at the margins of cardiac shadow. These are hilar shadows. The hilum of lung has pulmonary artery, pulmonary vein. So those shadows which are converging towards heart, so these are making some shadows, and hilar lymph nodes as well. So these are hilar shadows. These are hilar shadows. Look at the clavicle. This is right and left clavicle, and we may ask you to count the ribs in examination. So you should really observe it very carefully to look at the first rib. You can see this is the outline of first rib. On the left side, this is the outline of first rib. This is the outline of second rib. This is the outline of third rib, like that. Here again, this is the outline of first rib, and you can also appreciate some amount of blackness in the center here, in the lower part of the cervical vertebra and the upper part of the thoracic vertebra. Here, this is tracheal shadow. Air is present in the trachea. This is tracheal shadow. Sometimes this can also be taken as inference whether radiographically we can decide whether trachea has shifted to the right or left because of the fibrosis of the lung. Shift of this black shadow to the right and left can be easily observed in radiographs as well. In this way, where person is sitting and rays are passing from back to front, he will usually keep both his palms on his head so that scapula takes its position away from the lung fields. So we are not observing scapula clearly here. This is the medial border of the scapula. You can see this is the coracoid process. So this is the medial border of the scapula, which have taken away from the field to have clear vision of lung fields. So this position is maintained by the patient so that scapula is taken away from the field. We shall look at such radiographs. Again, you can see here this is the tracheal shadow, first rib of left side. This is clavicle, acromioclavicular joint. Here you can appreciate this is the medial border of the scapula, this is lateral border of the scapula, somewhat obliquely present because of the position of the patient. This is the lateral border, this is the medial border of the scapula, acromion, cardiac shadow, hilar shadows, ribs, dome of the diaphragm on the right, dome of the diaphragm on the left. Fundic gas is not very clearly observed here. This is apex of the heart, and you can see this one, this aortic knuckle, or this is because of arch of aorta, which is turning and going back and down and to the left. This is one more cardiac shadow, dome of the diaphragm right and left, and this is fundic gas. These are some gas in the intestine or abdominal cavity. This is tracheal shadow, both lung fields, clear lung fields, hilar shadows, clavicles. So whenever you comment on chest radiographs, you should say this is PA wave of chest radiograph showing cardiac field and both lung fields with bones and soft tissues around. This is lumbosacral exposure, where the area of interest is lumbar region as well as sacral region. To observe disc prolapse or any lumbosacral pathologies, you can appreciate all the lumbar vertebrae. I can say this is L1, L2, L3, L4, L5, and this is the sacrum. This is the coccyx. How I decided this as L1? Because just above this is T12. We can see the 12th rib articulating here on either sides of T12, and this is T11. This is 11th rib. There is no such rib here. That means this is L1. Lumbar vertebra 1, 2, 3. You can see the spines as well, which are overlapping. These are the transverse processes. 3, 4, 5. You can see the disc, intervertebral disc spaces, whether it is this space is decreased or on one side it is decreased. So this is sacrum. This is sacroiliac joint of the right side, and this is left side. It is marked. This side is right sided, and you can also appreciate pubic symphysis here, and this is head of the femur in acetabulum. This is iliopubic ramus. This is iliopubic ramus and pubic symphysis. You can see some shadows here. These are because of intestinal gas. They are showing some gas shadows. This is again one more such lumbosacral exposure. This is AP view and this is lateral view. All what we discussed here are present here. So this is T12 because this is the 12th rib. This is L1, 2, 3, 4 and L5, which articulates with sacrum. You can see the openings in the foramen, sacral foramen here, and these are sacroiliac joints on either side. This is area for psoas major muscle. You can see here, this is again psoas major, left and right, and this is lateral view. You can see this is the concavity made by the sacrum. This is the upper end, and this is L5, L4, 3, 2 and L1. This is lateral view of lumbosacral region. This is one more radiograph of lumbosacral region, both AP and lateral view. This is AP view, this is right side, and this is left lateral view. Left lateral view because they have mentioned it L. Again, you can see this is L1 because this is 12th rib, T12, 2, 3, 4, 5, and this is sacrum. gas shadows you can see. This is marking for psoas major muscle. And this is sacrum 5, 4, 3, 2, 1. And this is the shadow for the 12th rib of, yes, 12th rib. We can see some gas shadows as well. If the same exposure is little widened, say if it is little widened on either sides and whole of the pelvis is exposed and areas of kidneys have been exposed, such X-rays are also called KUB, kidney, ureter and bladder. If there are any radio-opaque stones present in the calyces of kidney or in the ureter or in the bladder, such calculi can be picked up by radiographs if they are radio-opaque. So such exposures are also known as KUB, kidney, ureter and bladder exposures. They are simple X-rays. We are looking at some stones without preparing the body, directly exposing the person under rays. This is a simple radiograph of KUB you can also call. But area of interest is lumbar region and sacral region. We can also call it as lumbosacral X-ray, AP and lateral view. To summarize, we have looked at some simple radiographs of head region, AP view, lateral view, and neck region, cervical vertebrae, AP view and lateral view, chest region, and lumbosacral region. In the upcoming module 4, we shall discuss on contrast radiographs or special radiographs of GIT, upper GI, lower GI, special radiograph for KUB, kidney, ureter and bladder, special radiographs for female reproductive system, special radiograph for CVS as well as RS.